Hello everybody and welcome to the Tuesday edition of Video Clips. And the first thing I wanted to do is address a common email posting I guess I get on YouTube from some of you who watch my videos all the time. The first one is some of you ask, why don't I publish all of your comments? And one of the reasons I don't is that this is not a community forum where we're all going to talk to each other and everybody's opinion carries equal weight and that sort of thing. So what happens sometimes is people will send or post a comment that challenges something that I've said, which doesn't bother me at all. It's just that if I just post it and I let it sit there without saying anything about it, somebody might perceive that because it's posted on my YouTube channel, I think that what the person said is correct, when often it isn't supported by the science. So many times what I'll do is I'll take those comments and they turn into newsletter articles, people asking me questions or challenging me about certain things. The second thing is people say, well, I want to look at the references. And basically, if you want the references that go with these articles, you need to subscribe to the Health Brace Library. That's where they are posted, articles with the references, and you can not only see the video that you're watching right now, but you can see 2,500 other articles that are posted in the library. So anyway, I thought I would just say it here, and everybody who's watching will know that, and I won't have to respond on an ongoing basis to the two things that come up. All right, a couple of other real quick things. The Diet, Lifestyle, Intervention course this summer is the one that features the celebrity instructors like Dr. Esselstyn, Dr. Goldhammer, Dr. Ralph Moss, Dr. Neil Barnard. If you want to learn from the best and the brightest, this is the time to take it. We only do it this way once a year. Winter and fall semester is just the regular Institute faculty, which it's still an amazing course, but a lot of people would like to be live and interactive for a couple of hours with people like Dr. Barnard and Dr. Esselstyn. So if you're interested in that, send me an email. I'm teaching a course on cancer, nutrition, and treatment this summer on Monday night at 9 p.m. Eastern. It's live and interactive. If you're interested in that, send me an email. And if you're thinking about a career in this field, let's set up a time to talk. All right, so the topic today, let's get right into the topic. Botox is the topic, and I've been asked a lot of times to comment on this. Finally had an opportunity to sit down and research this. So basically, Botox is a drug made from a neurotoxin that's produced by the bacterium Clostridium botulinum. Its effect on muscles and glands is due to the fact that it blocks the production of acetylcholine, a neurotransmitter. Well, what this does is it results in the paralysis of nearby muscles and nerves. Now, the beginning of how this was developed was an ophthalmologist by the name of Dr. Alan Scott, who was experimenting around with remedies for crossed eyes. And his hypothesis was that if you could use a small dose of a nerve toxin or something like that, it might relax the muscles enough that the eyes would no longer cross. Well, coincidentally, at the time, a biochemist who was working on biological weapons for the military identified and purified a strain of botulinum toxin. He sent a sample to Dr. Scott, who found that it was effective for muscle relaxation and could be used to treat crossed eyes. Well, further research identified a lot of other uses for the toxin, which included relief from facial spasms and neck and shoulder spasms. So in 1989, the FDA approved what was then called oculinum for the treatment of crossed eyes and twitching eyelids, and it was renamed Botox after it was sold to a company by the name of Allergan. Allergan has applied for or been given permission to use the product on 90 different applications at this point in time. So Botox is commonly or commercially sold under a bunch of different names, and it's used to treat many conditions, and the list is pretty amazing. Twitching eyelids, muscle spasms, migraine headache, hyperhidrosis, crossed eyes, post-stroke upper limb spasticity, urinary incontinence, and overactive bladder. It's also used off-label for a number of things like difficulty swallowing, anal fissure, hypersalivation, allergies, and cerebral palsy. It's marketed and sold under the name Botox Cosmetic for use as a treatment for things like crow's feet and lines between the eyebrows. It's currently the most popular choice for people who are looking to do something along the lines of cosmetic surgery. And in 2015, almost 6 million injections were given to people. That's quite a bit. A concerning trend is, number one, the increasing use of Botox and people who use it frequently, and also the lower and lower age at which people start using it. One of the things that really caught a lot of attention was when Ashley Simpson, at the time 23 years old, started posting on Facebook and social media that she was keeping up her appearance at age 23 with Botox injections. And it just makes you wonder, what is wrong with a 23-year-old who thinks that you need to do something like this to maintain your appearance, and what is wrong with a society that actually endorses this? I mean, it's very concerning to me. Well, let's get back to Botox. It's injected into neuromuscular tissue after diluting it with sodium chloride. It takes an average of between 24 and 72 hours for it to actually take effect. The results for cosmetic purposes, like wrinkles and lines and crow's feet, as I mentioned before, last about 3 months, after which you have to do it again. About 15% of patients begin to develop antibodies to it, which means that it no longer works, but theoretically you could continue to have these injections for the rest of your life, I guess, although I don't really think that's such a good idea. There are numerous risks, which is why I think it's not a good idea, associated with Botox, and this is a pretty long list. It includes pain, edema, redness and irritation at the injection site, numbness, headache, nausea, weakness, and paralysis near the site or even at distant sites, drooping upper eyelids, dysphagia or trouble swallowing, flu-like illness, gallbladder disease, bleeding, blurred vision, compromised vision, dry mouth, fatigue, hives, rashes, wheezing, and swelling. The FDA has mandated a warning label that lists side effects, and they can include death. There have been deaths reported from Botox. Patients who are given Botox for cosmetic purposes are told to remain upright for 3 to 4 hours after the treatment and to avoid massage or manual manipulation of the area, since any active contraction of the muscles can cause diffusion of the toxin into other places in the body. Drooping of the upper eyelid and or brow occurs in 1 to 3% of patients and lasts for 2 to 6 weeks. On occasion, it can become permanent. When used to soften crow's feet, Botox can cause weakness of the lower eyelid, leading to double vision. Paralysis of facial muscles, muscle weakness, and difficulty swallowing are also potential side effects, specifically when the injections are for cosmetic purposes. A common side effect of treatment for neck pain or spasms is difficulty swallowing, with one study showing an incidence rate of 28%. I think that's a pretty high incidence rate. Botox is contraindicated for people who have neurological conditions, including myasthenia gravis and neuropathy, for pregnant and lactating women, and anybody who's previously had an adverse reaction to Botox. And you would think that if you had an adverse reaction to Botox, that might discourage you from wanting another treatment, but actually that's not the case. Many people go back for more. People who take blood thinning agents like warfarin, aspirin, vitamin E, or NSAIDs should stop 2 weeks before in order to avoid inordinate bleeding or bruising. Now, Botox is at best a temporary solution for many problems such as migraine that are much better treated but with diet and lifestyle changes. In fact, if you read my newsletter, this week I have a part 1 of an article on migraine. Next week will be part 2. It includes probably 40-50 references about the causes of migraine and how to address them without resorting to things like drugs and Botox treatment. Each injection of Botox increases the risk that a side effect will happen, and some of them are very concerning and permanent and life-threatening. I have many friends who use Botox for cosmetic purposes, and they defend the practice by saying, well, you're right, there are side effects, but most studies show that they're fairly rare, and so I'm just not too worried about it. And my response when people say things like this is to consider this. If you were to be one of the people who ended up with an albeit rare but concerning side effect like temporary or permanent paralysis or a drooping eyelid, or your vision was permanently impaired, what would you think? Would you say to yourself, you know what, it is so worth it not to have crow's feet, even though I have this other thing going on now? Or would you say, maybe it wasn't worth it? So I think it's really important to consider side effects before agreeing to any procedure, but it's particularly important with one that is not critical and doesn't really offer any permanent resolution to the problem. And so one question that people will then ask is, if we don't do this for wrinkles and crow's feet, what are you suggesting, plastic surgery? And I don't know, I guess what I'm suggesting is that you do your best to look as good as you can based on the fact that we're all aging, and maybe this kind kind of insane idea that we have to look like we're 40 years younger than we are forever. We should just give that up and age gracefully. I don't know. That's what I think about it. Not everybody agrees, but I think I would do a lot of things to avoid injecting poison into myself with the list of side effects that I read to you here. All right, that's all for today. I'll be back to you on Thursday with more news, and please feel free to pass this on to anybody who you think might enjoy watching it.